And please introduce yourself.
Oh, I'm thinking of Uma and Nadia's remarks. Are your sources primarily internal? You're looking at how you can collect data. Dan, you addressed a little bit, particularly with the basketball example, you're being an outside consultant. Could each of you, or whoever appropriate, talk a little bit about who you're looking from data from, internal or external, if external, why, and just your sources.
This is Emma. I'll start. We look at all sources, actually, internal and external. We lean on WISIP for evidence-based interventions all the time. We hire consultants more often than not because we don't always have the capacity, which means we have to find a fund source to make that possible. Like right now, we have a funder that expressed an interest in doing a Pay for Success initiative if we would submit a proposal based on the return on the calculator and the data that came out on the homeless side. But we didn't have the capacity to complete that analysis ourselves, and so we had to put some money to find a consultant who would help us do that. We also are getting better at using the data that we have to answer some of the questions. But what's the point? We have so much data and we don't know what to do with it. And it's often very pointless because we're not asking the right questions. So building our own capacity internally to be a little bit more data focused. You know, if we were to see, for example, in foster care, we want to reduce bed days, right? Or we want to reduce the number of investigations in a certain way, you could structure that door, the front door, in a way that would reduce the entries, right? Or increase the exits. And what have you really done to address the underlying issue that was causing the problem? So we're starting to get better at asking some of those questions. But I would say overall, it's not just important to put the questions right, you need to know what to do with them and to build the capacity to, even to train your policymakers to read it a certain way and to do certain things with it. Here was a perfect conversation we had the other day. We said to our committee, our County Council Health and Human Services Committee, we've seen a 20% decrease in the utilization of our healthcare for the uninsured because we've significantly expanded health insurance using Medicaid and third-party insurance in our community. It's fantastic, right? So we have about $11 million worth of county dollars going into the healthcare program for the uninsured. We think with a 20% reduction, if that trend holds, we should be able to make XYZ reduction in the budget and move it into Program X or Program Y. We have some ideas. As the budget comes forward from the executive, we hope to engage in a discussion with you. So we put that out there. The advocates have come in with a budget request that's actually more for the same program, right? So they say, but why are they asking for more money? Well, here are the reasons why. This is what they're trying to do. But there's also this desire to be helpful to existing nonprofits that have had a historical relationship with the county for a very long time. I'm not knocking any of this. I'm just saying all of this comes into play when that discussion has to happen. It's not a simple matter of, well, here's what the data is saying to you. Now we're going to do X or Y. So, hope that helps.
On our end, we are primarily talking about external data, and that's because as an organization, certainly for the part of our work that's focused around pre-K through 12th grade, we actually don't house a tremendous amount of individual level data, and the data that we do house is mostly inputs related, and so it's sort of not particularly amenable to this. So that's why we are sort of looking externally, and I guess I would note with the sort of similar note of humbleness that I think that our systems for capturing data from the external folks kind of coming back internally are not necessarily optimal. So we too ask for a fair bit of data, but the time lag on it is really significant, right? So by the time a school district gets information on what happened last year, looks through it, makes sense of it, tells us what we need to know about it, we get it, we read it, we figure out what makes sense of it, like a long time has passed since that kid was actually in that class. And so that is very much an area where we have certainly tried to invest in better state level systems to capture that sorts of information. But I think the federal infrastructure is not remarkably robust, and I think that's also partly because there are often kind of particular concerns around what kind of information should sit at the federal level versus what should sit at the local level.
Could I, just before Dan speaks, I just wanted to add confidentiality and privacy issues between data systems are huge issues that we haven't talked about yet. FERPA, HIPAA, child welfare data, domestic violence, homelessness protections, victims of assault protections, on and on. We really need to bring some sanity to the privacy and security of data environment that exists at the federal and then consequently at the state level. That will provide some opportunities for us to actually get this systems data to not just at the aggregate level. A lot of your academics can go to an IRB and do what you need to do. For us at the program level, it's not that easy. We don't have IRBs for every transaction that has to happen. So I just wanted to put that thought out there.
I mean, for my basketball stuff, most of the data is either public or we're like purchasing it from some folks, and it's really the analysis that's internal and proprietary, more so. I mean, for the federal, it's a little hard to characterize, but I mean, probably most of the time that evidence is used, it's certainly not often the case that there's a burning issue that you have right now and you're going to go and obviously produce the evidence immediately. I mean, you're usually responding to either evaluations that have already been done, possibly internally, or existing research that's already been done outside that may or may not kind of answer the questions that you care about that specific specifically. But it varies a lot from agency to agency. There's going to be like some of the some of the more operational agencies may have some more of their own data and then they're doing more internal data analysis on their own versus other folks that are relying a lot more on kind of outside research.
So Dan, if we broaden the category though of what is the evidence base that gets used when a policy decision gets made, would you say that's largely most of those policies are being responsive to evaluations that were conducted? Or are you just saying...
I would say that's a mix too. I mean, so some of them are. I mean, sometimes there are evaluations that address the questions, that are important at a given time. But often there isn't any evaluation that's been done that addresses that specifically. And actually, obviously, ideally, you would. I mean, it's the whole body of evidence that you'd actually want to be using to try to inform those decisions. So I mean, I think it's a mix, there too. I don't know if there's any.
So just to, I'll go to Barry in a second, and then I'd like to see if Henry wants to weigh in. But I think the question was sort of, as people are making those decisions, are they accessing outside consultants? Are they reviewing the literature? Are they using their own data to generate cost estimates or something of the sort to make policy? So what is the, and maybe it's all of the above, which...
Did you? Well, I mean, I think this is where I was mentioning that, in the executive office of the president, they're going to have, either folks at OMB or, folks at the Council of Economic Advisors that they go to, or that's when they call up their buddies from, Harvard or, to help them interpret, what, various evidence says. So there's a lot of resources there. But I mean, I think as you get down, into agencies and into lower levels of agencies, their ability to kind of access, evidence in that way becomes a lot less. And then, I think they may be relying a lot more on their own internal evidence experts who may not be that much, that expert themselves. So, I think it's going to, vary a lot depending on exactly where the decision's being made and, and the nature of the decision.
Yeah, I wanted to tie some things I've heard from Uma and Dan and then what I had said. Uma talked about the unwed mothers and the investment in that now, and a teenage mother can save money in the homelessness in the future. And Dan mentioned WISIP, this Washington State group that we use at NGA or have well of. But he said two things about it. He said not only take a look at what it's telling him, but what it is not telling him. And then I started off giving positive words on CAPS. One of the things that I saw in my career, particularly at OMB, but elsewhere, was spend money now on this, and you will save money later. And this came up from a variety of senses. My favorite was the IRS. We called them the knee breakers. Spend money now on knee breakers and you'll get a whole lot of money in the future. And they give ratios, 2 to 1, 4 to 1, 10 to 1, and I'd believe everything I'd ever say. And I'd go into the director and I'd say, hey, these guys want to spend some money now, whether it be IRS enforcement agents or unwed teenage mothers, and they say they're going to get a return of something else. But before we create a separate category of spending for this over and above the cap, something that now that OMB calls program integrity, before you create that, let's take a look at the $10 billion they get right now. And if every $1 that they're spending right now has a return of 4 to 1, then by gosh, that makes sense. Then let's put the extra money in there. But if we can find some money in there that is getting a return less than 4 to 1, maybe we might want to cut the spending for that program that is getting less than 4 to 1 and invest it in this one that's going to get 4 to 1 or more. It is surprising. I never had that take up on a federal agency to go through that. In every case, it was, here's what we get. We want that, we want to protect it, and we want some more. And it'll get you 4 to 1. I say this because what I've looked at the WISP, you mentioned appropriately, it's a far from perfect system, but it also talks about what it is not telling them. And that's helpful to take a look at programs to see, some of these programs may be not producing the kind of information, the kind of results that we really expect. Because if you're going to win at this game, if you're going to get more money for things that are really valuable, you're going to have to probably replace some things that are going on right now.
I want to give Henry a chance to weigh in because you've been sort of sitting there on the phone, and then see if any other committee members have questions. Henry and Eric, do you have anything to add to this?
This is Eric. I think the thing that strikes me about this conversation is that there are really two different levels of decision making that we're talking about when it comes to using evidence and the kind of evidence that you use. In our experience, a little bit to what Barry had to say, we talk a lot in our office about how we're going to spend new money, where we're going to invest the next marginal dollar that we have available to us. And in that case, big published, peer-reviewed studies are very, very helpful in terms of helping us identify where we're going to put money to work in our budget for next year. But what happens over time is that money gets sucked up into the bureaucracy, and the initial idea that we had may not end up being exactly the way that we implement the programs that we worked so hard with the legislature to get passed. And that's where I think this day-to-day, almost very localized evidence and data that departments, that individual workers can collect becomes tremendously important in how we do our business. And as Henry mentioned earlier, it's the difference between a lead measure and a lag measure. And if you know that the work that you're doing is driving a specific output that you think in a year from now or 2 years from now may move the needle on a larger outcome, then it's incumbent on workers across agency levels, state, local, federal, however you define it, to be paying attention to what they're doing and identifying whether or not 2 years down the road what they've produced is actually creating the outcome that they had hoped it would create. And I'm not sure that there's necessarily a larger arena for the analysis of that evidence. I think it becomes a very important thing for agencies to be paying attention to at a localized level. And hopefully someday we'll find some way of boiling all of that up into something that is useful on a larger scale.
Thank you. I think that was a really great synthesis of multiple issues that are popping up here. Olga, you're going to ask. We have another committee member who's going to ask a question.
Hello, I'm Olga Costa-Price. I'm on the committee. I was curious if you could say a little bit, this was implied, but could you say, how do you judge individually in the positions that you're in, how do you judge the quality of economic evidence or evidence? And are there things you could enlighten us in our understanding about what makes you more or less inclined to incorporate evidence into your decision making? Are there times when economic evidence or the evidence available to you isn't going to be useful for some particular reason? So both the quality and how do you judge the quality, and that are there times you're making decisions where you've chosen not to incorporate the evidence for some reason?
This is Henry. Could I jump in?
Go ahead.
Thanks. It's a wonderful question. I think I'd offer two observations for our world. One, we want to make sure who sponsored the original research and confirm that there's been, as much as possible, an agenda-free initial investigation. I think that in our world, experimentation and mistakes are kind of luxury items, and so longevity of a program, scale, and connection to exactly the issues that we're working on, some attributes of all of those things, I think all of that combines to a gut level reaction on the people that we'd be trying to persuade, or even the people who are trying to persuade us. How much risk are we taking on with this being where we put our new dollar? So the elusive quality attribute, I think, we end up with a little bit of things we look for, like we don't see agendas, we see applicability, we see longevity. I will say, though, there's a little bit of kind of gut reaction thrown into there.
Thank you, Henry.
Just a couple of quick thoughts. So for us at the Department of Education, we do rely primarily on our kind of research and development wing, which is designed by intention to be independent. And so they have a kind of vetting process through their What Works clearinghouse that gives us some information about the credibility of the study. And so we very much rely on kind of their formal assessment, as well as obviously our kind of informal relationship where we want to talk about, tell us what this really means, and sort of help us pull it apart. So kind of rely on their good counsel and often their sort of public judgment about these things. So it's not a sort of secret that is somehow incorporated into our decision making. I do think that one of the things that we are not yet in a world where we are so evidence rich that we are disregarding evidence here, like sort of wildly. That seems like an exciting, not the disregarding part, but the part of having that much evidence seems like an exciting place to be. But I would say that sometimes some of the things that do pop up for us are some of the issues that we were talking about a little bit earlier, where sort of it seems really promising, but sort of the inherent structure that it would take is sort of a structure that is really untenable, right? So like, oh yes, if only we at the Department of Education would invest another $1 billion, then HHS would save $5 billion, is a great concept, and is absolutely the kind of information we want. We are not yet in a world where the systems to actually figure out how to make that argument in some sort of reasonable way are actually in place. So I think there's a sort of feasibility piece that sometimes gets in the way. And then a little differently, I would say for us, we think a lot about the question of scalability. So you may have something that has good evidence that works really well. So for example, there's an outstanding study about an effort to completely redo the teacher workforce at a particular school in New York City, where all the starting salaries are $120,000 a year. And the study says that this kids do much better. And in New York City, presumably a large part of what's happening there is you have a labor force where if you say for 120 grand, come here, people will actually make a different set of decisions, and that's a sort of rational set of behaviors, and so that's wonderful that works well in New York City. It's not totally apparent to me that that's going to work really well in a small border town in Texas, where you have a very different labor market, and so sort of asking people to take that on, you're not necessarily going to change the kinds of behaviors that you would want to change. And so there's some questions sometimes around this sort of question of scalability. And so for us, the frame might be, what we really care about is making sure that you have the best teachers you could possibly have in the building. There are going to be multiple ways to get there. If you're in New York, that's one way, but let us not use that as a path that we want everyone to take, because we don't think it's going to have the widest applicability.
The last thing I would, sorry.
Go ahead.
I think the question of data integrity and quality of data is it's an interesting one. I think we struggle with it all the time. There are programs where the data is very clean, and it's been for a long time. We've been scrubbing it and using it, And then there are other data sources that are not. And when you're trying to integrate the data to get to a certain, to inform a certain question, it's sometimes you luck out and it's good, and other times it's more problematic. And so I think depending on the question, you may get a different answer in the quality of the data question. The thing that I think Henry mentioned this, that the question of risk resilience is a very different question. Most public sector entities are more cautious just because resources are short, and how much experimentation do you have the capacity to engage in, and what's your risk resilience? Our attorneys, our risk managers, often the frame is why you may not do something because it violates a certain regulation, as opposed to this is the goal you want to get to, and here's how we're going to let you get there. And I think that's a complete reset in many ways. So if the data says X, Y, and Z is maybe dubious, not sure whether it's working, or it is working, we need to do more of, you end up playing a game of 20 questions, and you keep trying to answer the question, and then it leads to more questions, and it leads to more questions, and ultimately the answer comes back, no, you may not. And so sometime along the way you start to wonder, why are we even bothering? And so that's the disincentive in the system that you sort of have to fight against. I'm continuously pushing in my own sphere the question of, if you want to be innovative, and if you want to if you keep doing the same thing over and over again, you're going to get the same results, you want to try something different, then let's all be sure that we have a risk resilience quotient within ourselves that we've evaluated, and we know that we can tolerate some level of risk. Because if not, then why venture forward, really? And I think it's a question that anybody attempting to do anything has to answer up front. Otherwise, you're in for a lot of disappointment along the way.
Okay, I'm going to take one more question from one more committee member, and then we're going to move to public questions. So if folks want to line up at the microphone if you have questions, but go ahead, Jean.
Thanks. This is Gene Sterling. I'm chair of this committee. Several of you made comments to the effect that when you do a lot of these studies, they tend to be on new items or incremental items. And yet, in a lot of the budgets, local, state, and federal, there's less and less incremental money, in part because of the existing programs of the base, which several of you said doesn't always get examined. The base sometimes even has automatic growth, and so there's new money, but it's counted as the old program, so it doesn't get examined. So one question is, how can we expand the use of economic evidence to go cut back further and cover more programs, including existing programs and programs that are expanding automatically? And then there's a related question, which is, and I don't know quite how to do this, but are there ways to do relative comparisons? So it seems to me in a lot of budget contexts, the question is, do we spend on X versus Y, even though the evidence on both of them may be fairly limited? And one reason that's important in this, particularly for this committee, is we're talking about investing in children. And I think there's, at least among some people, an implicit belief, well, if we invest in children, even if it started to produce the same rate of return, it would be a rate of return that would last longer, sort of like putting money in a pension plan early rather than later is going to help your retirement more. So that gets to this question about, are there ways to do relative comparisons with economic evidence? Even if you can't prove this has got a rate of return of 5 or 10%, you can say this particular program clearly would have more of a return than another, or maybe preventative health has a higher return than acute health. Those types of questions.
First of all, I think I agree with the observation that I think evidence does tend to play a bigger role in kind of new decisions or with new money. I think those types of decisions tend to come with priors that are not quite as strong as the ones that you have with kind of existing budget, decisions. And so there's a tendency then for evidence to be able to play more of a role in a situation where you don't have as strong a priors. There's also just not as, there's a natural decision-making point that takes place with new money that doesn't take place with existing money, as clearly. Although I think, there are processes like PART and things like that I think tried to create, ways in which you had to kind of look at, some of that evidence. Forget what exactly the second question.
Had to do with can you make relative comparisons?
Well, that goes back to the WISP stuff kind of, I mean, that's where I think if you have a system where where all the studies are kind of put into a system where they're looking at everything in a comparable way, it's just several orders of magnitude easier to kind of do those kind of comparisons. If you have a series of cost-benefit analyses that use completely different methodologies, and then you're trying to answer that question, I mean, even the most brilliant of us are kind of going to be at a loss, in that kind of circumstance. And somebody who's obviously less sophisticated than that, it's going to be that much, more difficult. And so I think that's where, even though I think it probably, all of us are kind of dissatisfied with all the compromises that you kind of have to make to have these kinds of systems or standards or something like that. It probably still is worth the trade-off because I think it just makes it so much easier to ultimately be able to make decisions. And I think folks over time can learn how to deal with some of the problems that those kinds of systems can kind of have in a way that is somewhat sophisticated.
Barry, Henry, anyone else want to hop in on the question of, I think we had one about, are there processes for existing programs? I think, Eric, you made that point very eloquently, that it's definitely, there's more of an approach when there's new money, but there's decreasingly new money over time, if that's the right way to put it. And then also this question of relative trade-offs.
This is Henry. We have started this base review concept. I worked here for 2 governors ago, and we had an initiative that was kind of like a base review concept. But I think the approach we're doing now is far, far superior, and we're partnered with someone you'll hear from, I think, in the next session with this results first examination of our existing adult correctional type programming with a focus on what helps you with recidivism. And I think it's important for 2 reasons. One, we shouldn't only pay attention to the incremental dollar. We have to examine our performance now. But also, we've always, for our discussion today, we've been talking about the new dollar. What became interesting about this project to me is, well, what happens when we have to cut our budget? What are the things we want to make sure we don't get rid of and make a mistake on the way down? So the gentleman's question about base review is a very important one, and that is where we are spending some serious time right now, albeit we just have the first analysis into the one area.
And I'd jump in and say one other thing about base reviews, and that it's very, very difficult to review your base budgets. And I was a bureaucrat when the administration 2 governors ago was working on this statewide targeted base review, and it became very easy for bureaucrats to game that system a little bit. And instead of look at our programs and what we were doing and identify where we could cut or what wasn't working well, it turned into an exercise of it's not working well, mostly because we just don't have enough money. So if you give us more money, everything would be fine. And that was in the end a very disappointing exercise for a lot of us in Colorado. What we're doing now is also trying to build a really robust performance management system so that we encourage state employees all across Colorado to look at the work that they're doing on a day-to-day basis and determine whether or not it's actually helping them meet their objectives, and document that and trace it over a number of weeks, months, and years. So I think a big part of smart targeted base reviews has a lot to do now with effectively managing what's already in place and not necessarily going back from a top-down perspective and asking bureaucrats to justify their existence, because they'll always justify their existence in a way that suggests that they need more.